An electrolyte imbalance is akin to a lever system, in which the body's equilibrium or balance point serves as the fulcrum. The lever stays in equilibrium as long as electrolytes like calcium, sodium, and potassium are balanced properly. On the other hand, an imbalance, such as having too much or too little potassium, is like adding weight to one side of a lever, making it tilt. Just as an unbalanced lever can result in instability, this imbalance can cause a number of health problems. Do you feel strange these days? If so, it's possible that your body is trying to communicate with you by requesting more electrolytes, those small yet powerful minerals that are essential to maintaining the proper balance and functionality of your body. But how can you tell if your body requires more electrolytes? For your body to operate correctly, the balance of electrolytes must be maintained. Seizures, cardiac arrest, and coma are just a few of the major issues that can result from severe electrolyte imbalances. An electrolyte imbalance is typically caused by a loss of bodily fluids. This may occur, for instance, following protracted diarrhea, vomiting, or sweating brought on by a sickness. Additional factors that may contribute to it include fluid loss from burns and certain medications like laxatives, diuretics, antibiotics, and chemotherapy drugs. Additionally, conditions like liver cirrhosis, heart issues, lung disorders, and acute or chronic kidney disease can cause it. An imbalance in electrolyte balance can result from consuming too many processed foods that are high in sodium and low in other vital minerals. Electrolyte imbalances can also result from not drinking enough water or perspiring excessively, especially in hot weather or during vigorous exercise. Substance abuse and eating disorders are recognized causes, as well as overhydration or water intoxication, that is, drinking excessive amounts of water. These electrolytes include sodium, potassium, calcium, chloride, magnesium, phosphate, bicarbonate, amongst others. Sodium helps with nerve and muscle function and regulates fluid levels. The heart, nerves, and muscles are supported by potassium. Along with boosting your metabolism, it also transports nutrients into cells and waste products out of them. Calcium aids in the dilation and contraction of blood vessels to maintain blood pressure. In addition, it secretes proteins and hormones that aid in the nervous system's message transmission. Chloride contributes to the maintenance of normal bodily fluids, blood pressure, and blood levels. Magnesium supports healthy nerve and muscle function. Additionally, it encourages the development of strong teeth and bones. Phosphate is essential for the health of muscles, nerves, and the skeletal system. Bicarbonate aids in maintaining blood pH balance by balancing basic alkaline compounds, bases, and acids. Additionally, bicarbonate facilitates the passage of carbon dioxide, a waste product, through your bloodstream. Here are some warning signs that you shouldn't ignore. They serve as an indicator that your body's electrolytes aren't in proper balance. You may be having low electrolyte levels if you experience painful cramps or spasms in your muscles, especially if you are low in potassium, magnesium, or calcium. Typically, the first symptoms of dehydration or sudden drops in potassium and magnesium levels are muscular weakness and spasms. Hypocalcemia or low calcium levels can result in convulsions, cramps, and pain in the muscles of the abdomen. So it might be time to resupply those electrolytes if you frequently experience muscle cramps. Do you feel tired and lightheaded? An imbalance in electrolyte levels may be the cause of persistent fatigue or mental fog. In addition, hyponatremia or low levels of electrolytes like sodium can cause fatigue, disorientation, and trouble focusing. Also, magnesium deficiency may make you feel exhausted. Are you struggling with a chronic headache that just won't go away? An electrolyte imbalance might be indicated especially if you have lost sodium due to vomiting, diarrhea, or sweating and are dehydrated. Low levels of electrolytes, such as potassium and sodium, can upset your body's fluid balance, which can impact blood flow and possibly cause headaches. If you have a headache, try increasing your electrolyte levels before taking a pain reliever. Electrolyte imbalance can also manifest as digestive problems such as constipation or diarrhea. For you to be able to use the restroom, the muscles in your digestive tract must contract correctly. The fluid flow in your digestive system is regulated by electrolytes like sodium and magnesium, which help to maintain a healthy balance. Constipation, cramping, diarrhea, and hemorrhoids can all be caused by either high or low electrolyte levels. Inappropriate magnesium levels, excessively low potassium levels, hyponatremia, and extremely low sodium levels can also occasionally result in nausea. If left untreated, this same condition can lead to headaches, confusion, and breathing issues. Vomiting or diarrhea, which are frequently accompanied by nausea, can lead to dehydration. Another important warning sign you shouldn't ignore is an irregular or fast heartbeat. Calcium, magnesium, potassium, and sodium all play important roles in heart health by assisting in the regulation of electrical impulses in your most important organ. Palpitations, an irregular heartbeat, or more serious cardiac problems could result from these electrolytes being unbalanced. Muscles may become weak, tingly, or numb as a result of problems with normal nerve-to-muscle transmission caused by an excess of certain electrolytes, such as potassium, a condition known as hyperkalemia. High potassium can also affect your heart rate and result in fast rhythms that can induce anxiety. Excessively high calcium levels are also frequently associated with abnormal heartbeats because they have a major impact on the heart's electrical transmission pathways and cardiovascular system. An electrolyte imbalance may be the reason behind persistent feelings of not being able to breathe deeply enough. This is the reason. When electrolytes are depleted, your body struggles to carry the electrical impulses that keep your heart beating regularly and balance your blood volume, which prevents your cells from getting the oxygen they require to function. Does your bones hurt? The body can sense an imbalance in electrolytes in areas other than your muscles. Bone pain is another possible symptom, usually caused by high calcium levels. That's because if the electrolyte leaks out of your bones, it can cause high blood calcium levels, hypercalcemia, which can lead to skeletal weakness and pain. Uncomfortable kidney stones, nausea, vomiting, and constipation can all be caused by extremely high calcium levels or hypercalcemia. Feeling weak and exhausted and having difficulty focusing can also be symptoms of the same condition. Anxiety and difficulty sleeping. Most people are aware of how difficult it is to go to sleep and stay asleep when they experience muscle spasms, an irregular heartbeat, or night sweats. Even though you may feel exhausted all the time, persistent pain and mental disturbances can make it difficult to get enough sleep due to low magnesium and high potassium levels. Irritability, confusion, and dizziness, hypernatremia, or excessively high sodium levels can cause these symptoms. You might get even more delirious, have a seizure, or go into a coma if this gets worse. Intense thirst, dry mouth, and tingling or numbness, usually in the extremities, are other possible warning signs. Don't ignore any of these signs. Make sure you get enough water each day, especially if you're exercising hard or it's hot outside. Keep yourself hydrated and think about rehydrating with sports-specific snacks or drinks to help restore lost minerals. Note that it should be consumed in moderation. Eat a range of foods, including fruits, vegetables, nuts, seeds, and lean proteins that are high in important minerals. Limit sodium-rich processed foods. If you take any medications that affect your electrolyte balance, speak with your doctor to see if any changes need to be made. Also, you should schedule routine checkups with your healthcare provider to ensure your health is being monitored if you have underlying medical conditions that may affect your electrolyte balance. If you enjoyed the value you got from this video, kindly give it a thumbs up. Hit the notification on your screen to get notified once we drop more insightful videos. Don't forget to leave us your thoughts in the comment section below. Thanks for watching and see you in our next video.